Uh, Babies who have congenital abnormalities, they can be lethal in some cases, and knowing those babies are in the tummy and carrying on pregnancy is very distressing to a mother, knowing that baby is going to die anyway. So these sort of babies, whether we allow the pregnancy to go on or not, is very difficult question. Mothers who undergo these situations will know, will have so many issues during pregnancy. Even family life will be affected. They can have so many medical problems thinking about the unborn baby, who the baby may not live for long.
Doctor, if you are comfortable, you can move your hand.
Yes.
Do you want to take that again?
It's okay. Yeah.
Or do you want to continue from there?
We'll continue from there.
Right.
These mothers may need counseling from an expert, especially a psychological person, because she knows she's carrying a baby who will not survive. And as I told you, the family problems which we have seen even ended up in divorce cases. So the carrying on the pregnancy is very, very questionable.
Can you shed light on the potential impact of a lethal congenital abnormality on the newborn's quality of life if born?
Yes, some of the babies with lethal abnormality means we don't expect these babies to survive. Even if they survive, they will survive only for a few hours. So one of the condition, if I tell you, is anencephaly, where in layman's term, its brain is not developed. When the brain is not developed, these babies we can't expect to survive. Though they can breathe, those breaths will not last long. These babies will die in front of you. It's very saddening to see these babies die. Another condition is where the kidneys are not formed. Generally, we call it Potter's syndrome, where the kidneys are not formed, and when the kidneys are not formed, their usual life will not be expected. And these babies also tend to die, but a bit later, maybe a day or so. Another condition we call it when the lungs are not formed. Sometimes it's called the thanatotropic dwarfism, where the lungs are not formed, the chest wall is not formed. So these babies also will not survive. So there are some other conditions also which are not compatible with life. So continuing these babies in utero and delivering them and seeing them die is very distressing.